smartlocal.com.
3, 2, 1.
Hi!
What is a perfect face to you?
Oh, one that fulfills the golden ratio thing.
I think there's this golden ratio thing where like your forehead must be, I don't know how many cm, then how many cm. So yeah, it's very difficult to achieve that kind of golden ratio. But there are some people who don't have this golden ratio and they're still very beautiful.
I feel like a face, right, need to have a bit of flaws. If you see a face and it looks too perfect, right, then you look like AI. If that's what celebrities are going for, then sure lah, cause you know they are like celebrities. But the rest of us, let's just be normal. Like, if not, we'll all like be walking AI everywhere like, with perfect faces for what?
Share the insecurities you have about your face.
Oh! Wow, what am I? I'm actually, wow, that's
My first and biggest insecurity, right, it's not really like the features like specifically eyes, nose or mouth. It's more of my dark eye circles. They are really dark. So whenever I don't wear makeup to the office, right, people will always say two things. Either I am sick or is it like I never sleep the whole night.
First and foremost, I wish that my forehead didn't have its own zip code. My nose a bit long for my face. Although I did my eyes before, I wish they could be bigger. I don't like the shape of my face because it's a bit, for the lack of better word, it's a bit 2D.
There are comments suggesting that there are parts of my face that I could change. I have a large protruding forehead, and that Fauzi forehead is still huge as ever! All I can say is that my forehead is probably brighter than your future, so. One of the biggest insecurities I have also is about my neck. There's a lot of lines, very lot of wrinkles. Because I'm older and everything is sagging.
On this episode of Singaporeans Try, you'll be getting virtual plastic surgery. We'll be heading down to SW1 Clinic at Paragon to get honest consultations from a plastic surgeon.
Oh my! Who's this plastic surgeon?
You meet Pearlyn.
Oh, she's a girl! I love it! Yes, I trust.
We will virtually transform you into your ideal face and then head back here for the review.
Shit! Who knows, it will become real maybe next time. Kidding!
I'm Chia Hui Ling. I'm a consultant plastic surgeon here at SW1 Plastic Surgery Clinic.
Why did you choose to be in this profession?
I first encountered this phrase when I started my training back in England, in Cambridge, and it was known as the problem-solving specialty. Every day you will meet a different patient. You come up with solutions, unique solutions for your patients, and that's what really made me tick.
What are some common misconceptions people have about plastic surgery?
Cosmetic surgery is a big part of what we do, but we also do other non-cosmetic type of work, medical work, reconstructive work for cancer, for trauma.
So last question, What is beauty to you?
I think being healthy, beauty inside, it shows on the outside. Okay, let's start with how can I help you?
I don't know! How can you help me?
Let's talk about the first thing you spoke about.
My forehead.
Which is the forehead.
Yeah.
It should be in thirds. This is slightly higher than the rest of the thirds.
Okay.
Right? And part of it is because of a bit of receding hairline.
Yeah.
So I would say that hair transplant to advance the hairline.
Oh.
So that shortens the forehead.
Okay, when can I sign up?
Then let's move down.
Right.
I think you have bright eyes,
yeah,
you have nice crisp double eyelid falls, and that is part of the feature of having deep set eyes. But one of the downside of having that is with age you find that you're looking more tired over time.
Correct.
And that's because of this shadow that you see around here. And we call this the tear trough. Surgically, something more lasting is do fat grafting. To remove fat from anywhere you desire. So this fat, we can process it and use it like a filler to augment this area here. And also to fill under the line to smooth it. And let's talk about your other concern, which is the
double chin.
and the lines. Okay. Your chin is a little on the small side. So if your chin is more advanced, it sort of pulls the double chin forward. To improve the texture of these lines and the pores, nowadays I use a product called Profilo.
Okay.
It's made of hyaluronic acid. When it's injected into the skin, it will help to plump up the skin, plump up the line. I know you like your nose, but I can comment.
Okay, sure, please go for it.
Ideally, the nose should be a little narrower.
Okay.
Yeah, it should be close to or between the two inner canters. What we can do to reduce this, a little bit of this flaring, is to do aloplasty. The lip is a little bit protruding, so we can also do a lip reduction. Then also we can do rhinoplasty to improve the projection of the nose. It's not that you have a lot of flaws, it's what matters for you.
Yeah, of course.
We will, there are suggestions for that.
Right.
Okay. I think you have a beautiful face, right? When you walk into the room, you do light up the room, right?
Baby, you light up my world like nobody else. The way that you flip your hair gets me overwhelmed.
In the chin-wise, more apparent from your profile view that it's slightly shorter. Yeah.
This area looks very short,
Yeah.
which makes my face look like bigger from the side.
Your nose is got a nice projection. So if you draw a straight line down, ideally the chin should be not that much, but a little bit more projected. Non-surgical, you can use fillers, and surgically will be either using chin implants or what we call genioplasty. It advances the bone forwards.
So you want to do?
In terms of the nose, the side profile of your nose is beautiful.
Beautiful.
But it's just from the front, it's a little broad. What I usually do for this is a tip plasty to refine the tip of the nose, right? So dark eye circles, in your case, you have quite different dark eye circles on both sides.
Yeah.
The right side is actually eye bags. One way is to remove this excess fat. In the left side, it's more depressed. For that, this eye, something like a filler will be better if you're considering non-surgical. If you're considering surgical, then it will be something like fat grafting.
I don't know if you all have this procedure to say change the shape of the lips, because my lips, right, you can see is drooping down. I want to have like really like your lips.
Okay. So sometimes fillers in this area will help that also.
Yeah. This question is not meant to be, say, like offensive or attacking you in any way. Okay, it's a genuine question. Do you personally think that you're beautiful? You constantly every day have to, let people know this and that, right? You might have also all these insecurities about yourself.
So because I know what is the ideal, so you will be always constantly be comparing yourself, right? Honestly, I feel that as I grow older, I feel more secure, and I also focus on other things, right? When I think about what I should do with my kids this weekend.
I think you are very beautiful. Legit, I cannot stop looking at your eyes.
Oh, is it? Thank you. Before I start, have you had any surgery or any procedure done for the face?
Would you like to guess?
Forehead?
Actually, I got put fillers.
Yeah. Close your eyes for me. Is there a scar there? Probably the cheeks may be filled also.
No.
Okay, then moving on the forehead. So you have naturally full cheeks. Okay.
Too much.
Here, fillers.
She's good.
When we look at the face, it should be in thirds. The forehead's a little bit more in proportion to the rest. With the hair transplant in this area here, it will be more effective in correcting the problem. And we spoke about the eyes, right? I would suggest to do a revision. Maybe like a brow lift will increase this distance, and straight away we can see that actually the double eyelid comes back.
I like your parallel eyelid. It's
thank you.
parallel. Yeah, so the one that I wanted to go for, right, when I was in Korea was actually what the doctor called parallel eyelid. So The eyelid, instead of looking like that, it's like that. To the Korean doctor who operated on me 9 years ago. Why my one like that?
Close your eyes maybe. Open. Yeah, so you can see.
Wow.
Facilitate the parallel flow.
Should I have bought a house?
The jaw, you could do jaw surgery is to straighten the jaw. An alternative is to augment the lip.
So I should get some from Fauzi. His lips very thick, right?
So you do have very full cheeks, but a lot of the concentration of the full cheeks is on the outside. And the front is actually relatively flatter.
It's like, you know.
I would suggest it's drastic, but it's to reduce the cheekbones. And then when you enhance this area, not too full overall.
Okay.
That's quite a lot of work.
Oh.
Yeah.
Not something I would like to hear from a doctor. Quite a lot. Yeah, quite a lot of work.
Overall, you're beautiful, but all these things that we have pointed out to me,
Everybody has their own insecurities, I would say. Like things that they would point out.
I'm a
themselves.
hammer, right? So
Yeah.
I can correct every single problem, but it doesn't mean that it needs really to be corrected.
Welcome back!
Yay!
Yeah, after sales.
Okay, just a disclaimer first, these photos are just a rough idea.
Okay.
2, 1. Oh my god, wait!
Oh, wow.
Okay, so
I
the
can
hair
see.
transplant.
Yeah, the hair for sure.
What happened?
Okay, so like
The
the
nose.
the nose, right? You see, she's smallened the nose.
You just look younger.
Yeah, I definitely.
Very much younger. Do you prefer this?
I don't really know, honestly. Okay, I'm ready to see the
This
side profile. Oh my god.
Oh my
No, that's
god.
weird. Don't look like me.
Yeah, it looks like your nationality changes. The first before it looked a bit
Yeah.
Looks a bit like Lohan Lee, right?
You freaking. I think like certain things I feel like I would definitely do is like the reduction of the lines. The nose, I think lips only lah. Okay.
You know how much people like this kind of lips?
Yeah lah. That's why I should
Kylie
start.
Jenner.
I should just start my own lipstick line.
Yeah.
Called Fauzi.
Okay, let's see Brenda's. Wow, look at that.
Yes.
God's favorite.
Okay. 1, 2, 3.
What's the difference? The same lah. Okay, she removed the under eye
Yeah.
area.
Oh, actually, I'm not mad like that.
Yeah, it's nice.
I think she also did the fillers at the chin area to lift up my mouth.
Okay, let's see your profile, shall we?
Sure got no difference.
Oh,
the chin.
yeah, the chin.
What? Oh my god. I want to do my chin now.
But actually, honestly, it looks like you.
Yeah, you just look like.
Yeah.
It's like if I come to office one day like this, you all won't
No,
cannot tell, right?
cannot tell.
Wow, then
But if I come in the office with a wig like that, I confirm people tell.
I will walk past him and be like, have you seen Fauzi?
You're before. You look like you want to kill someone.
I always smile in photos because I always
Same,
look like I want
same,
to kill somebody.
same. Okay, here we go.
Okay.
Wait! What did she do?
Okay, it's a brown.
You look damn happy now. It's like suddenly the eyebrow.
I look like I'm questioning something. Hey, but can I just say she did a very good job photoshopping the double eyelid?
Yeah.
The eyes is really something that
You
I would
would
have
do.
wanted to achieve last
Right.
time.
Oh, profile.
oh, you really look
my
like
God.
you ready to beat someone there.
Let's see the after.
Okay, let's see.
Yeah.
Wait.
Now my forehead real estate is really tiny.
Yeah.
Previously it was a bungalow, now it's a BTO. So
Oh, yes.
she gave me some Fauzi,
Oh yes.
Fauzi lips.
Oh yes. You want to
But
take some of mine?
it doesn't look good on me, Fauzi lips.
Yeah,
oh
the
yeah,
cheek.
then here also
Yeah.
pop up a bit. The front
Yeah,
is
the front
okay.
not bad leh.
The front is okay.
Like the more I see it, right, the more I think, right, if I keep seeing you like this every day, I will think it's you.
yeah.
Yeah.
Aiya, see lah, why I renovate my house for what?
You can renovate your face.
Yeah, that's one tilam enough for me.
How was the experience?
Eye-opening. Literally.
I'm confused
Why?
because I don't know whether I want or not. for me, right, what I would like are the minor improvements that kind, like the remove the wrinkle, maybe just get rid of the eye bag, that kind. Simple things like that lah.
I think Brenda don't need to say.
No wait, yeah, that's why I feel like they're talking to each other.
Yeah, because Brenda
No
already
wait, I have things to say.
talk to me when you need to get a hair transplant.
I need to say, okay, God is fair. God is fair. I got insecurity for my body lah.
Oh, I thought about your stupidity.
Is there anything you would like to say to anyone out there who may not be confident about their looks?
Oh, beauty is temporary, dumb is forever.
Oh my god, I feel so attacked by that.
Wait. But it's like, like it is something to think about lah. That is your value is beyond just your how you look, right? It could be because you've got a great personality, maybe you're a genius.
But I think if you want to edit your face, you want to renovate your face, just...
I mean, it's really, to be honest, it's really your choice lah. At the end of the day, it's really your choice.
And I feel like you should respect other people's choices.
Yeah, for sure.
Yeah, because there are still quite a lot of people who shame people who do plastic surgery.
Yeah.
And if you're all about, respecting others, why not respect other people's choices?
Correct.
Plastic
For
surgery.
sure.
Like just now I spoke to Dr. Chia. She also mentioned that confidence stems from within.
Correct.
Like you have to love yourself and be confident with who you are, because if you're not confident, right, no matter how much changes you make to your face or your body, you'll always see something you want to change to.
Yeah.
You'll never be satisfied
Correct.
with the outcome.
Correct.
Thank you for watching this episode of Singaporeans Try.
If you enjoyed this video, don't forget to like, share, and subscribe.
Ring the notification bell and watch our other videos over
There. Bye.
Sponsor us.
Sponsor us.
Wait, I don't know why she was on this episode.
Us!
Doctor, I don't know why I'm here. Because
Yeah,
to
okay.
be honest, I'll rate myself a 10-10. Minus 0.5 for height, minus 1 for humility and humbleness. But I think I'm a 10.
I think you only need help if you feel that there's something is lacking.
So you also think I'm 10-10?
Yeah.
If you want, you can take a picture now, then you can put in your office. So
Oh,
people want
yeah,
for
the
perfect
ideal.
face, smile.
Okay.
I won't check.